Alright, so a few pieces of helpful equipment when you're working with the cat are going to be a non-slip mat and a towel down on the table. I would always suggest having an extra towel with you as well. It's helpful to have a cat muzzle if, just kind of in case, if you haven't seen a cat muzzle before, this is what one would look like. They are different in the sense that they cover a cat's eyes where a dog muzzle does not. That is because cats do not do well with seeing what's going on around them. Dogs like to know. Cats, it's better to limit their sight, to limit their sound, kind of sensory deprivation, if you will. So it's good to have a cat muzzle around just in case, especially if you have previous bad behavior written on that animal's chart or anything. It is helpful to have multiple sizes in case you need to put one on. You're not having to run and get a different size if you need it. It's also helpful to know, I don't know where they put my other cat glove. I was passing them around this morning. Thanks, Tiffany. Yeah. It's also helpful to know where your cat gloves are, what they look like. I really like to say that cat gloves are a last resort, though. I think sometimes they can be used prematurely. There's kind of a lot of other things you could do before you get to this point. Like if the cat is clinging to the ceiling and growling, yeah, pull out the cat gloves, you know. But if he's just in the carrier, like in the back, hissing and growling at you a few times, I'm sure you can probably go about it differently without pulling these out. You kind of decrease your sensation a lot with these on. You guys can pass them around, stick your hand in there. You will be safe when you're wearing these. You're not at risk for any bites or scratches, but it's decreasing your sensation. So you're kind of risking potential improper restraint or anything of the sort. You guys can, sorry, I'll take one and you guys can pass them both ways. Another important piece of equipment is going to be feline pheromones. Does anybody know what the pheromones are mimicking?
The saliva and the energy. Is it?
No, not necessarily. Or kind of specific.
Is it like mating?
A mama cat.
Oh.
So any synthetic pheromone is going to mimic the mother's pheromones. So cat pheromones mimic mama cat pheromones. There are dog pheromones, but most clinics don't use them. Don't ask me why. We deal with dogs way more. Cats are more fractious, though, more typical to be grumpy in the clinic. So when we use cat pheromones, this is just the box for you guys to see what they look like, but usually they'll be in a spray bottle. If it's not in a spray bottle, they do come in wall plug-ins that kind of diffuse, but those can sometimes be not as good because you're like, most of the clinics aren't going to unplug it after the patient. Like they're just going to plug it in and leave it, and then you're kind of wasting that pheromone. With the spray, you can spray it per patient. So say this cat came in, his name is Bobby, the owner's chart already says bite risk or will bite. I know that that means I should probably have my cat gloves, have a muzzle, have my non-slip, my towel, my extra towel, my pheromones, everything that I can to try to alleviate some of that FAS, right? With the pheromones, Sophia, go ahead. No, good question. They are not scented. We can't smell them. You can put it on your clothing. You can put it on your skin, and it should not affect you. Did you have another question? No. So when we spray pheromones, you should typically spray the room, any equipment that you're going to be using, and yourself about 10 to 15 minutes before you even think about bringing that patient inside. You want the smells kind of lingering and settling. You don't want to spray right before that animal comes in. So I would take my bottle out, I would spray the towel, I would spray my extra towel, and I would spray myself. I might even just spray in the air a little bit. Please do not spray the patient. Do not spray the cat. Don't do that. Alrighty, so a lot of how you proceed with a cat is going to going to depend on the cat's temperament. So the first thing I'm going to do, sorry, doing too many things.
It's okay.
The first thing I'm going to do is when the animal is handed to me, if they're in a carrier, you're always going to support the bottom of the carrier. You are not supposed to just walk around with the carrier like this. You have a lot less control of the carrier, and the animal feels less supported in the carrier. So always one hand underneath, one hand on the handle. First thing I'm going to do is set it on the table, usually towards the back end. Some other things to talk about before I continue here. We, like I said, want to kind of limit the cat's visibility when we can. We also want to be aware of the sound level. So cats are very sensitive to sounds. Every carrier, you bump it and it's loud. They don't like that. They're going to respond to it. So we just try to be aware of those different things. Try to keep your volume level down when you're working with cats. One other thing, because it happened to, I think, Nat and Jocelyn the other day, this table. If you guys don't know how this table works yet, it folds up. It can fold all the way up and sit right here parallel with the wall. Almost every exam table is built like this. I figured out my seniors didn't even know about this, so it's not that you didn't do anything wrong. If you are unaware though and you lean here and then you make that noise or you shift the carrier, so just other things to kind of be aware of, right? Go ahead.
So what if, because they don't like to see, or it's better for them, wouldn't it be better to face it the other way?
We're getting there.
Okay.
So I'm going to set this carrier on my table, and the first thing I'm going to do is probably what? First step, foremost. Maybe introduce myself. How could I do that?
Opening the cage, but like away from you.
What should I probably do before I even open the cage?
Like wash your hands or put your hands on it?
Yes, that should be done before any of this. What else? Before that
Supply treats.
is
Or-
something very, very simple. Don't overthink it.
Just show your face.
I want to look at the cat, right? I want to look at the cat.
Okay.
I'm going to look in the carrier. That's it.
Um,
I need to know what this cat is doing, how they're feeling. I need to observe everything I possibly can. And then I can approach, right? If I haven't even looked at the cat yet and I put my hand right up here and he goes, he grabs my arm and I'm already
True.
bleeding and the appointment hasn't even started, I could have avoided that, right? I'm not going to do anything. I'm going to set the cat down. I'm going to look in the carrier. Go ahead.
Wouldn't you want to subtly look at them? Because doesn't direct eye contact, isn't that uncomfortable?
Yes,
for
but
them?
what did you say?
For when you're, because you said to look at them so that way you can analyze body language.
Correct.
Yes? So you would do that subtly. You wouldn't go.
Oh, subtly.
Like,
yes.
Okay.
Yeah, I mean, you're not gonna like. You don't want to scare them, but you can peek in there without being. I'm gonna have a mark on my head now. You can look at them without being scary. You're just looking. You're not doing anything to them, right? Oh, brother. All right. So I have looked at my cat. What might tell you anything about the cat?
The ears or
Ear position. What else? Pupil size. What
the
else?
mouth tension.
Mouth tension. What else? Positioning in the
Yeah.
carrier, right?
Cower.
So if this cat was not a happy cat, they're gonna be in the back, either facing you, facing the side, facing the back of the carrier. They're gonna be as far away from you as possible. What else might they be doing?
The tail might be tucked in.
Usually with an upset cat, the tail is going to have fast flicks or movements. It's not really gonna be cuddly tucked in. What else?
True.
Hissing, absolutely. What else? Growling at you, swatting at you. There can be a lot of signs. What about the opposite? How would you know if it's a happy, calm, ready to come out and see you cat?
Like the closed eyes.
Like relaxed little blinkies, slow blinkies, right? What else?
Ears.
It's probably going to be up here towards the front, looking at you. Right up here. What else?
Probably like laid down.
Comfortable, right? Not tense. What else?
Purring.
Maybe purring.
The pupil looking not be as wide.
Regular pupil size. Some other ones we talked about this morning was even like cats really like to rub their chins on stuff, so they might be rubbing up on the front of the carrier. They might be meowing like a regular happy meow. They're not gonna, you know, they're happy meow. There are lots of signs that you guys can utilize to figure out how to proceed from here. So there's gonna be a lot of variation. If this is a happy cat, I'm gonna open the carrier. First
Okay.
thing. I am hoping that this cat comes out of the carrier on his own. If I open it and he's not immediately coming out, what could I do?
Like treats and toys.
Treats, right? Low level treat, high level treat, maybe a toy. I'm going to try to lure the kitty cat out. You don't want to ever reach into the front of a carrier like this. You're going to, scary, I don't want that. You're gonna make them respond in some way. So you want the cat to come out on their own. This is stuffy, so I'm gonna move it, but pretend that I'm not. So say this kitty cat starts to come out. Say he's right here. At this point, I want to go ahead and try to get a hand on this animal. I put this on backwards earlier, guys, so it would really be best for me to be on that side of the table, or if this was over here, I'd be okay. But I put it on opposite this morning. Either way, as soon as this cat starts to come out, you want to get a hand on the animal. If you just let the cat come out on its own and you're like, yeah, he's fine, he's gonna, no. He's leaping off the table, I promise you. Sorry if I hit anybody. So as soon as he starts to come out, we want to try to use a touch gradient like you guys have learned. So usually kind of around the shoulder area is gonna be the best spot. So I would be talking to the kitty cat, I'm gonna go ahead and start touching him, and I'm gonna let him come out all the way. And I'm typically gonna go right into a C grip and kind of my other hand on the body. So C grip, remember that we need to be on top of the head and underneath the jaw. We cannot be at all in front of that lip area. You will get bit. So you can switch arms for this. It's really whatever you're comfortable with or whatever needs to be done. But I typically use my arm closest to the head for the head, and my other arm, my whole forearm up against the cat's body, and my body to squeeze him in, right? So say this kitty cat was here for a jugular blood draw. I'm already in the right position here. The cat can stay laying down. I have control of the back end of the body. I can elongate that space for the doctor. I could be more towards the end of the table, but I'm not going to do the table stretch technique, right? Not comfy for a kitty cat. I can still stretch upwards and forwards, but not over the table. For a jugular blood draw, you are not really holding off at all. The doctor will typically do that when they poke. We'll do cephalic next real quick. Any questions so far?
When you would encourage it to sit the same way that you encourage the dog to sit before you have it laying down like that?
Yeah, cats are really like movable though. They're a lot smaller, so most of the time they're gonna be more crouched down anyway. You really have to encourage them. Sophia?
Is the jugular more common than the cephalic?
Yeah, good question. We talked about that this morning. Thank you. So in kitty cats, the most common is going to be jugular. In dogs, we'll probably always go to the cephalic first unless we know we need a large amount of blood. Cats, you have to imagine that vein size, right? So vein here is pretty small. Here is even smaller. Jug is our biggest one. So in cats, it's typical, yeah, to just go jug immediately. Good question. Cephalic next. So same C grip on the head, same forearm on the body. I usually, if this is a happy cat, calm, happy cat, I don't necessarily need control of the other paw. I can maintain control of this one paw that's getting the blood draw done on it. So this is where in the morning I realized I hadn't covered dog blood restraint yet. When you are holding for a cephalic blood draw, I'm going to get Rampage in here in a second for you guys to see the motion that I'm talking about. Your hand placement is pinky behind the elbow. If you have your pinky and partial of your hand behind the elbow, it's going to force the arm to extend so that that animal cannot retract in the middle of a blood draw.
Right.
If the doctor already has the needle in the vein and you allow the animal to retract the arm, you essentially have blown the vein. They won't be able to use that vein that day or potentially even that week anymore. You'll have to switch arms. So you want to avoid that. In dogs and cats, you're always going to be on the opposite side that the blood draw is happening. You want to create the most space for the doctor. Besides, let me just say this real quick so I don't forget. Besides the elbow behind the pinky, so I'd be here, I am going to take the thumb on the medial aspect of the paw and roll overwards. So remember the cephalic vein crosses right about here. I want to grasp the vein, roll it and occlude it. So I'm pushing down to make the blood kind of swell up in that area to make it more prominent. I allow the doctor to poke once I see that they're in the vein, and I will be able to see that because right here at the base of the needle, where the needle meets the syringe, as soon as you enter a vein, the pressure from the blood flow will create what we call a flash. So there will be a little bit of red it literally flashes right here before the doctor starts to pull the blood out. When you see that flash, you want to release the pressure off of that vein so that the blood can actually flow out into the syringe. Once the doctor, I guess I still need this. So let's say this syringe is in the vein, and I am right here. Once the doctor starts to pull this syringe out, pretend that I have a third arm. You are going to, at the same time, push your thumb down over that needle as it comes out. The doctor or whoever's doing the blood draw is only supposed to pull the needle backwards, so you should not be at any risk for them poking you. That really is going to be essential for you to have your hand in the right spot, though, because if you move, that's still putting you at risk. So you have to be stable, and the doctor has to know what they are doing. Okay. We'll do medial saphenous real quick. All of these are with a calm, happy cat. So medial saphenous, any questions? Can I keep going?
Yeah.
Go ahead.
For the jugular, would you also have to occlude it?
No.
No. Okay.
So cats, to get to their medial saphenous vein that's on the inner aspect of the back thigh, we kind of want them in lateral, right? But we don't necessarily have to do the whole lateral flip like we do in dogs. These guys are small, we can maneuver them pretty easily. So what I like to do, and there's some variants here. So I prefer the C grip always. So I would get a C grip. I might grab the front paws, how I normally do in between my fingers here right at the wrist, and use my forearm and my body to kind of flip the kitty cat, right? He's already in lateral right now. What's more suggested and what's more common in clinics is not the C grip, because you guys can see it's a little bit awkward at this angle.
Yeah.
What you're gonna see is a scruff here.
Oh.
So they're gonna scruff the cat, they're gonna use the forearm on the back, and then we're going to need access to this back leg, so I'm really not gonna hold these front paws at all. What you need control of is the top leg and the tail. So we're going to tuck those into the belly, and then with this flat karate chopper edge of my hand, my pinky edge, I'm going to push straight down. That is going to occlude the vein for the doctor on that bottom leg. I need the tail out of the way, I need the foot out of the way. You don't want them to get poked in the process. You really should not be scruffing a cat that is over a year old, but for that position, that's just what is most common.
On an aggressive cat, even with, let's say like you even have like the muzzle and thing, and what if it's like still like going crazy?
We're on happy cat right now.
Okay.
Whole nother ball game.
I was gonna ask, well, like you said, scruffing isn't really recommended. Isn't that like not, what's the word? Like you don't have as much control over the head either? Or
You do, but it's more so about the cat when it comes to the scruff. When you scruff an animal, you have control of the head, but it's more about the response from the animal. When an animal is a puppy or a kitten, they have an actual bodily response to a scruff. Once they start to age, that response is not the same and it becomes painful to them. So it's really counteractive. But for that position specifically, it's really what's easiest, but not necessary. Any other questions right now? Okay.
would you still use a C grip? Sorry.
You could. So we're gonna talk fractious cat next. This next part, I'm gonna show you guys really quickly one person doing it, myself. But it really should be a two-person job, and you guys will see why once I do it. Oh, name my cat. So we are now dealing with a fractious or aggressive, anxious cat. So I've set my carrier on my table. I've done my little peek. He's facing the back corner. He's growling at me. I know this is not going to be the easiest appointment, but I know how to proceed. First thing I'm gonna do is flip the carrier around.
Okay.
So now he's in timeout, right? He's looking at the wall. He's not going to be seeing all the things happening around him. First things first is opening up the carrier. So, oops, immediately. There are lots of different types of carriers. We have 3 different types here. I want you guys to get comfortable with the ones that we have. But another thing to just kind of visually observe is when you first get the carrier in your arms, look at how it opens. Look at the mechanisms of it. You don't want to be just fiddling trying to open a kennel for 20 minutes. This one is missing a few pieces, so like if you were to be aware that these 2 on the back are missing, you might not want to lift it solely from the lid. It could open up or create space there. These ones, they work just by like turning them parallel or perpendicular. Do they come out? That one just has little latches, and the other one we have is actual screws on top and bottom that you have to take both pieces out. When you take the pieces out to open up a kennel, you should keep your hand on the top of the kennel. If it's a really crazy cat, they will try to get out. They might bump the top, open it up, and they'll be gone. So first things first, you're opening up the entirety of the kennel. You want to keep track of all of the bits and pieces. You don't want to have to go back to the owner and be like, sorry, I lost all your screws. Good luck getting the cat back home. So I've taken all my bits out. I'm always going to set them on a different table. You don't want the cat to kick it in the middle of the procedure and then you've lost it again. This next part is where your extra towel comes in handy. So I like to, and again, hands should be on that the whole time when the screws are off. I like to prepare the towel over my arm like this. I'm going to grab the lid of the carrier, and since I'm doing this on my own, I don't have to communicate with anybody on timing, but I'm going to open the carrier just enough on the back end for my arm and the towel to fit inside. I'm going to drag the towel all the way over this patient and gain control of the head as soon as possible. You have to know which way the cat is facing to do this properly. One of the big mistakes that I see is they do this and they just assume that this is the head, and right now the cat's head is right here. It's going to turn around and bite you. So I knew that the cat was facing this way. I would have to put my hand right here to have control of that head.
Do you like grab or push down?
Grab.
Grab. Okay.
So once you're at this point, once you have the towel over the cat and you have a hand on the head, you're going to shift this hand from the handle to grab the top and the door. If you don't grab the door right now with the lid, it's gonna, and you're gonna freak out your cat.
Yeah.
Okay? So you're going to grasp. At this point, the head is in your hand, so you're not at risk to put your fingers through the front of this cage door. Sorry, I'm trying to get it back in here so it's accurate. All right, so I'm gonna grab the top here and the door. I grab it like this if I'm doing it by myself, and you want this out of the way. So I'm gonna go this way. And you can see how this would be better with 2 people, right?
Yeah.
So if there were 2 people, we would just communicate. One person would be in charge of the cat, the other totally in charge of the carrier, all the pieces. Yes.
If you're dealing with a fractious cat, wouldn't you always want it to have another person?
Yeah. Mm-hmm.
No matter what. Okay.
Once we're here, you start bunching that towel around the kitty cat. And depending on the procedure, you could do everything in here. The doctor could move around me. They could come over here and take the temperature. I would recover it. They could come up front. I have control of the head. So they could check the ears. They could check the mouth. We could do everything in here potentially. If we need a blood draw, maybe not. So we can do a few different things here. I'm going to kind of swaddle or just scoop the cat up in the towel and bring him out. If I had 2 people, we could communicate and do that a little bit more fluid. The person would take it as I lifted the cat and I would just set it right back down instead of moving my spot on the table. I want to show you guys the grip that I have right now because it's a little bit different. So instead of a C grip, when you go over with the towel, it's best to put your 3 center fingers on top of the head, thumb and pinky on the side behind the ear. This gives you really good control of the whole head, and you can also give them little scritchies on top of their heads. Okay, so that is what my hand looks like. Even through the towel, I can feel the ears under in between my fingers right here. At this point, I would need the carrier out of the way. And in order to perform a kitty burrito, I really need this towel. This one doesn't really matter. It's in my way right now. So I would probably move this towel. I would grab the head. I hopefully would position my cat in the middle of the towel. So say we're here with a fractious cat. I'm gonna let go for 2 seconds. I usually position my towel like this when I know I'm gonna do a burrito. It's just easier for me. I have control of the head. The first step you're going to do is cat's in the middle, both directions. You want at least 3 or 4 inches in front of the front toes. Your very first step is to cover those toes. So you're going to go over the front feet and behind the neck. Once you have that over the front feet and behind the neck, you can let go of the head. You have control here. You're then going to go side, back, side. It doesn't matter which way. Usually, like I'm right-handed, so I go left to right. You're going to wrap one side. You're going to do the back end, but you do have to be careful here. If the cat's tail is straight out and you do this, you're going to snap the tail. You're going to break the tail. So make sure that their tail kind of tucks up with them, like when they loaf and they tuck everything in. Tuck that tail in and fold your back side, and then your final side over the top and even underneath sometimes. Now we have no feet, right? No limbs. Everything is contained. I just have the kitty cat's head. So I could safely perform a jugular without doing anything at all, really, just holding the head. Say I needed cephalic, the doctor really wanted cephalic, I could use my body and my forearm to squeeze the cat in. I'd have control of the head, and I could pull one of these little arms out. And I can still get behind that elbow and hold off on the vein for the doctor. So this is going to be a much safer method for a fractious cat. You're limiting movement, you're limiting their arms, their mouth, everything from reaching you. I'll try to show you guys another day the 2-person cat carry removal, and we went kind of fast, so we can cover some of these things again if you guys would like. Really quickly, I want to show you guys on Rampage a cephalic hold, and then I'll do lateral for you.
Okay.
Let me grab it.
There's like 10 minutes left.
That's why she said really quickly.
Bro, so ready to practice on a legato when I get home, bro.
Yeah.
Remember that other day you didn't let me cut your nails?
You're like, oh, I got you now.
I got you. Guys, make sure that you can see. Sorry, I'm just grabbing cookies. All right, so Rampage is 75 pounds. There should be 2 people restraining him, but I want to show you guys that it's doable because some clinics will not have the help required and some have a lot of extra help. Like at your clinic, I know that you've had to restrain an insanely large dog by yourself. How much pounds? That Great Dane you told me about? Edgar Park.
That one, I think we did 3 people.
So some clinics are going to have extra, some are not going to have enough. First, I want to show you guys cephalic. So, all right. So with Rampage, he's a less is more dog. He does not like to be restrained, but I would come in on him. I would have control of the head up against my shoulder here on the hard surface of his body. And if I bit this, if I get my pinky behind his elbow, his arm is going to be straight out. If I hold here, he has the ability to pull back. If I get up under this elbow, it's going to extend. It's a natural response. He has no choice but to extend that arm. I'm going to reach inside, roll the vein. You guys can see it popping right there. He's going to lay down. So I'm trying to show you guys, so I'm moving around. But overall, control of the head, behind the elbow, from the inside, roll it. That vein is very visible right now.
So it rolls out the vein? It rolls
Correct.
from the
It rolls
inside
on
to the
top.
outside? Okay.
There's a crumb, get it. All right. lateral. It is hard by yourself, but it's doable. So
You said he's at 75 pounds?
he is 74.2.
I was 74.2. Yeah.
So to get him into lateral, I need him in standing. Again, you can see he's a less is more. He's leaning away from me. He does not like to be held. I have him in standing restraint, and I can move into my lateral restraint. He's really tall, so I have to kind of like go high up on my knees to reach those down legs. If I wasn't in a skirt, I would have one knee up, one knee down, because he's so tall. I'm gonna go back here. Oh, brother. So I have both of his down legs. I need him to go up, and I'm going to slide him down my legs to slowly get him to the floor. Once I have the ankles here, he can't move. I use my elbows on his ribs, kind of his shoulder and his hip, and he's stuck. The second I let go of these, he's getting up. Any animal will. Usually fully up, but he had a lick. So, Emma, can you do double person with me real quick? I want you guys, yes, to see the difference in a two-person lift. Especially with the longer-legged dogs, you really have to make sure that you do a little bit of an up before swiping them out, or that leg will get caught and you'll break it. Okay. Okay, camera. 1, 2, 3. Slide down the legs, and I get some extra control of that head, right? Good boy. Yes, good boy. Any questions, guys? Okay. Good job, Pops. Good. Look at good mom. Yeah, so if you're not using your body and you're not using your legs, if you just flop them underneath, if you pull those legs out, he's gonna bam, whack his head on the tile. He will give himself a concussion. Any dog would.
What about the jugular?
I didn't have time with the morning class, and I know that I sped through all of that with you guys, so we'll stop there.
Okay.